Hi, good night, classmates and Miss. Today, my partner Lorna and Angie, we are going to talk about the federal program that helps patients navigate Medicare may be cut. This is a big, especially me. I'm going to talk about in Colombians issues. And this topic was addressed by Oscar Bernal, that is a doctor in public health, and he's working on investigation on biomedical issues in the Autonomous University of Barcelona, and with the help of Catalina Gutierrez, that is a doctor that have a special. She specializes in economics on the New York University, and they involved in this issue to try to see which one was the worst facts that, or the reasons why the health system in Colombia is like that. And they found especially that have a big features in the system, because when you are going to be attended in some place, you have to go first to 3 or 4 places, and they give you the authorization to have a medical care. And if you are in an emergency, that will be very dangerous, because you can die very easily and very quick. And also, as this is so big, like the people that is involved, so many people, and when some issue comes out, nobody wants to be responsible from what happens with those people that even die. And another was that the system was very complex and have many people that is working in the system. So when the system, as I said, when the system is each time complex, it will be harder to organize, and there is less guarantee that it's working as it's supposed to. And they also believe that this is a weak system and a very corrupt one, and in an economic view, it's unworkable. It's an unworkable system, and it must be changed completely from the root. And one of the things that fear most the Colombian people is that these have many cases that pregnant women they just wait even sometimes days until they give birth in the floor, because they don't have the medical attention that they need, because they have some issues with the medical secure. So this can't happen anymore. So my partner Lorna and Angie are going to talk about the issues of Honduras.
And so with Angie, we're gonna talk what happens in Honduras, and what really happened is that the government is not supporting what is the security system, the social security system, because people say that, but not people, but the news are that the government are like using the funds for the social security system to use the money to like
themselves.
themselves to organize the political campaigns for the presidents. And what happens in 2010 and 2014 is that in the government of Mr. Lobo, the money, there was like 120 millions of dollars that were spent just in the political governments.
Yeah, there was this problem with the woman that was she was having an affair with the director of the Social Security. So they had like this relationship, and both of them, they get together to do a corruption act of robbering $9.2 million to the Social Security. So what this caused was like there wasn't enough like service for in the medicals, like they didn't have medicines, they didn't have equipments and all those type of things to attend the patients.
Yes, so the problem, what really caused was what Angie says, that the hospitals didn't have the medicines, didn't have technology, didn't have anything to support the patients that goes, and when people is dying, just like in Colombia, the women that give births on the floor. Right here, people just go to the doctor and ask them to give them a treatment, and people just don't give the treatment because they say they don't want to give treatment because the government doesn't support the social security system. So what is happening is the people is dying and nobody goes to the hospital, or it's just not supporting each other. And also there's a lot of people involved, not just Maria Zelaya that was the director, but also there's 320 people that is trying to be investigated to know what really happens, the money that was destined to social security.
There is a problem in the hospital in San Pedro Sula, Catarino Rivas, that people go to the hospital to get attendance, but the problem is that they don't have medicines and all those type of things, and they just give a prescription to the people, like them to go to a pharmacy to pay the medicine, which is something it costs a lot of money. And the problem is that people goes to the streets, they get out of the hospital in the streets, and they start to ask for money, and all the cars that pass by, and also they get to the part that they can assault people just to get the money for them to buy the medicine. And
so it's supposed to be that the system helps the people that doesn't have money to go to another hospital to do the treatments, because they spend a lot of money that they don't have. So as we see, there's this problem in all these countries, as in Colombia and Honduras, and what we really need is a change of politics that helps the people, and as also the people that was involved in this, it doesn't have like any problem, because nobody is like trying to stop them. They're just doing these problems to the people.
Something that I see that we share is that politicians are mixed with the health system, and this can be happening because politicians have to be apart from the healthy from the population, because a campaign can be a reason to the people die. So this was our video. Thank you.